Hey, good Friday afternoon, Scranton. Great to see you. It's getting very cold out there. I just took my scarf off, but I think I still need it. I wanted to make sure that this week we were focused on the reason that we began these town halls in the first place last year was COVID and getting information in as real time as possible to the community to protect ourselves and each other from COVID-19. And I thought it was very timely, and I'm so appreciative to Geisinger for having a couple of our Scranton CMC doctors on with us today. We have Dr. Nanvit Singh Dang from Geisinger. He's the interim chief medical officer, and someone you've seen before, Dr. Pragya Davadel, infectious disease specialist from Geisinger. She's been with us literally from the very beginning in March of 2020. I wanted to bring the doctors on from Geisinger. I think many of you probably saw on Wednesday and Thursday that the Geisinger system put out some information about what it's like at the hospitals right now and the level of concern about the variants and the level of disease. And of course, the most important thing, making sure people understand why getting the vaccine is so important. So I'm not the best person to talk about this, so I will leave it to our great doctors at Geisinger to explain more. And really, please, listen again for any points that resonate with you that you can share with loved ones, share with neighbors, share with friends about what's going on in our community. So Dr. Dang, do you want to start us off?
Sure. Thank you, Mayor. First of all, I really want to thank you and the whole team for giving us an opportunity. We just wanted to share some of the insights, what we are seeing. We are really seeing a significant uptick in COVID cases, not just in our hospital in Scranton, but across all our hospitals within the system. And this is not just unique to Geisinger. We have seen similar trends across other health systems as well. We have really sick patients waiting in the hallways and waiting rooms because we don't have enough inpatient and ICU beds availability at our Scranton campus as well. So some data, I would really like to share some data points which will really help illustrate the current state. We have been running at more than 100% capacity for last several weeks. And 24% of our hospital census is actually COVID positive. That is every 1 in 4 patients in the hospital right now are getting admitted with the COVID diagnosis. And if we did some deeper dive into our COVID patients and some internal data that I'm going to share, 90% of COVID inpatients are not fully vaccinated. So that highlights that how important vaccination is. And another data point that I would really like to share, only 2% of COVID inpatients have been vaccinated within the last 6 months. So that really highlights that how protective vaccination is. And I'm going to ask Dr. Davadel to actually talk a little bit more about importance of vaccination and some of the other points. But we are not only seeing COVID patients, but we are also seeing stroke patients, heart attack patients, heart failure patients, and the volumes have been really, really high. That has put in a significant strain on healthcare systems. And I'll ask Dr. Davadel to elaborate on some key points.
Good afternoon, and thank you, Mayor and team, and thank you, Dr. Dang. So as all of us, we have seen that Pennsylvania is among one of the top states in the country to have high rate of hospitalization due to COVID-19 cases. And we here at hometown at Scranton and community center, Geisinger Community Medical Center is no different. Dr. Dang alluded the gravity of this situation. This is a very serious situation that we are in now. And if we compare it to last year, 2020, this is definitely, we have reached this number sooner than in last year if we compare it. We are seeing, being a frontliner, taking care of COVID-19 patients every day. Personally, what I have seen is two things. If you, when you go home, go out, it looks like, the pandemic is over, but in the morning when you come to work, the situation is different. It's grave. We are seeing all the beds in the hospital full. If you walk in the emergency room, there are patients in the hallway, which we do not want. And in fact, there are patients in the waiting room with long waiting hours who need to be started on treatment. And you walk up to the hospital to the wards where the patients are, like intensive care unit or progressive care unit, or even in the COVID unit, there are sick patients, sickest of the sick. And what we have seen is, compared to last year, the majority of the patients are not vaccinated. And if you look at the age group, these are younger patients compared to last year. And at one point, a couple of weeks ago, all the patients in our ICU were in ventilator. And even now, more than 50% of the patients are COVID patients. And, I would not take a lot of time to talk more about the patients, but there are patients, I'm taking care of a patient who's in like 20s in the ICU for more than 2 weeks in a ventilator. Obviously, the patient is not vaccinated. There are families, husband, wives who are admitted, not vaccinated, severely ill in the hospital. And there are some patients, who have a better outcome. They are able to go home, but then in a very severely decompensated, debilitated condition requiring skilled nursing facility or a lot of support at home. And we don't know when they will get back to their baseline, right? And we really don't want that kind of outcome, because compared to last year, the situation is different. Last year, we did not have vaccine. This year, we have vaccine. There is a preventive measure to prevent all these sad stories, sad cases. And I urge and I plead everyone, if you are not vaccinated, please go get your vaccine. If you are fully vaccinated with 2 doses of mRNA vaccine, either Moderna or Pfizer, and that was more than 6 months ago, and if you then please go and get a booster. And a good thing is that just yesterday, CDC announced that people 16 and 17 years of age can get Pfizer mRNA vaccine. So here's a chance, grab and go this opportunity so that you do not get ill, sick by this virus, or like have severe illness that will, necessitate you to come to the hospital, get admitted. And the other thing is, yes, there's no vaccine which can prevent, any perfect vaccine that can prevent illness, but vaccine can definitely prevent serious illness that can, necessitate you to come to the hospital, right? And continue the other mitigation strategies, like wear your mask, especially if you are around people, your loved ones, your family, friends who are immunocompromised, or who, for one or the other reasons, cannot get vaccinated. Let's protect them, keep them safe. I know like holiday is coming. It's been a rough and a year, the past 2 years for us. We all want to celebrate our tradition, keep our tradition, but let's do it safely. Let's continue. Let's understand that this is a serious situation, and we need your help. And if we stack hands together, I think we can definitely get through it. And if you have any questions about vaccine, reach out to the healthcare provider who can explain you more. That may, help you to make the best decision. Mayor, up to you and Dr. Saxena.
Thank you, Dr. Dang and Dr. Davidel. We deeply appreciate you coming on today, and we really appreciate everything that you and your team and all of our healthcare workers are doing every single day. I understand what you're saying about the disconnect between reality at the hospitals and what you see when you walk into the grocery store. I know I'm one of very few people wearing a mask at this point when I go into a store. And we've really got to understand that this is still going, and it's really a miracle that the vaccine, the COVID shot exists. And so we need to keep doing all we can to try to get folks to do it. The stat of 90% of, you said 90, right? 90. Yes. 90% of the patients that you're seeing with COVID are unvaccinated. That is a striking statistic, and I hope one that that really hits home with people. We don't want any more people to suffer. We don't want any more people to die. And it's hard. It's a hard reality that we're sitting post Thanksgiving yet again in a situation here in December like we did last year. So if there's anything else that you all have, I'll have Dr. Saxena talk about our upcoming vaccine clinic. Any place that, vaccine, the booster and the vaccine, the same shot, it's ubiquitous at this point. Really, I believe you can just walk into some of our, I think the prescription center on Cherry Street at Scranton Counseling is walk-in. I know there are appointments available at Scranton Primary and a host of other pharmacies. Any other places that you all recommend?
Yeah, Geisinger has many vaccination sites. We have one in Mount Pleasant here for Scranton. There's one in Pittston. And then, across the region, in central region, western region, there are other vaccination sites as well. And anyone can enroll on it by going into the website. I do not have the site right now, but I would be happy to share it with your team.
Okay, thank you. And Dr. Saxena, the next clinic for us?
It's on December 28th from 2 to 6 p.m. and we'll be giving, and this is with the partnership, this is in partnership with the Scranton Primary Healthcare Center and Department of Health, and we'll be giving all the COVID related shots for ages 5 and above and flu shots as well. And this is, it's at Old Army Reserve Center on 1801 Pine Street. But otherwise, as the mayor said, there are so many so many pharmacies which are giving the shots. So just avail those facilities, and of course you can walk in this clinic as well. I just wanted to share some data, which is from Pennsylvania government website, and the local city data is earlier it was around 33 cases just a week back, and now it's up to 39 cases per day. And whereas county data has been around 100 to 150 cases per day. And regarding hospitalizations, I know Geisinger, you guys talked about the data, hospitalization numbers going up, but I just wanted to bring out the data. So today it is 87 cases in the county, and this has significantly gone up in last 10 days when it was around in 60s. So that's just shows how it has increased, how much it has increased. So other than that, yes, the booster has been approved, as Dr. Pragya said, for the ages of 16 and 17 from today onwards. So just go and check and get yourself vaccinated. Thank you.
Thank you all again for everything you're doing and for the information. Having us be able to talk with you, access you throughout, and then especially as we head into this, this phase of things, really, really helps us and all the residents of Scranton. So thank you.
Thank you, Mayor.
I'd say have a good day, but I know you're not going to. So we'll be thinking of you and doing our best to give you fewer patients.
Thank you. Thank you so much.
Thank you. Thank you both. All right. Thank you, doctor. We'll see you soon. Okay. And I would, as Dr. Saxena leaves my office, I will say that as opposed to last year, this is a lot easier with her on our team. So thank you.
Thank you so much.
I'll see you in a bit. So that's, that this is why we do these, for that information. So it feels a little weird to switch to other pieces, but there are still some great outside activities that we are able to enjoy in a safe manner. So I'll go through a couple of those. Just give me 1 second here. Great. So I wanted to remind everyone that NAOG is lit up, and well, actually, sorry, let me grab some questions about. Okay. Okay. So I do see. So where to get boosters? We went really, Joe, I think we did go through some of those where you can go. A lot of the pharmacies have them. I know, again, the Scranton Primary, the DiPietro's, on Cherry Street, the prescription center. I think somebody said here on the chat said Wise Market. That I'm not positive about, but I imagine at this point it might be accurate. And the Geisinger, Mount Pleasant, and you can always call your primary care doctor. We'll have one of the clinics, like we said, on December 28th at the Scranton Center up by NAOG. So for NAOG, the holiday lights are going all of the time from 6 to 9. Well, I think it's from dusk until about 9 p.m. It's free, but they do take donations at the end, or you can Venmo a donation. But the team has done a really, really amazing job up there. And don't forget, there's a box to mail a letter to Santa if you so choose. Sloan and I and my mom mailed Sloan's letter to Santa earlier this week, and that was really fun. And you'll get a letter back from Santa, which is always a delight, as much for me as Sloan in our household. There's let's see, there's a trolley celebration this weekend at the Trolley Museum. So December 12th, 10:30 to 3. You go to the Electric Trolley Museum, there's a trip on the trolley. You need a reservation, so call 570-963-6590. Tickets are $10 for children and $6 for adults. Oh, that doesn't make any sense. Okay. There is a holiday punk rock flea market. That sounds cool. December 19th, 12 to 7 at the Kaiser Valley Community Center. Very, very cool there. That sounds indoor, so please be aware of that. December 19th from 12 to 7. So I appreciate it if folks would wear masks to that. Friends of the Poor is doing another great food basket giveaway. This one will be right before Christmas, December 22nd, 9 to 4:30 at the Armed Forces Reserve Center. That's 3401 Oliphant Avenue. All you need is your zip code, and you can go December 22nd, 9 a.m. to 4:30 p.m. Backyard Ale House downtown is also doing a Christmas breakfast. I believe they've done this a few years now. Christmas morning, December 25th, 9 a.m. to 11 a.m. at 523 Linden Street. Okay, so we've got a couple of coat drive pieces. Clothesline for men is low on items. They need work boots, sneakers, sweaters, hoodies, winter jackets. You can call 340-6086 for information to drop off those items. There's also a coat drive donations for UNC, sorry, the UNC Youth Winter Coat Drive. Donations accepted until December 22nd. You can donate at the Oppenheim Center on Jackson Street, the UNC Admin Building on Alder Street, the Community Education and Revitalization Building on Cedar Avenue, which is great. And call 961-1592 for information about that. Okay. There's quite a lot of information out there now, which is great, and uptake now on mortgage and utility assistance programs. We're excited about that. So you can go to relief@uncnepa.org. For UNC, for rent and utility, for mortgage, you can call 558-2490. The former SLHDA, which was empowerment, you can call 575-2938 for a range of assistance programs. And of course, if you or someone that you know is dealing with a mental health or addiction issue, please reach out and get help. Scranton Counseling Center is 348-6100. Outreach is at 348-6484. The suicide prevention line, 1-800-273-8255. The Children's Advocacy Center is 800-932-013. Catherine McCauley Center, 342-1342. The Women's Resource Center, 1-800-257-5765. And the Veterans Crisis Line is actually the same as the National Suicide Prevention Line, 1-800-273-8255. So we'll switch over to questions. I saw a note about subtitles. I think that we've tried that, and we'll keep trying to sort that out and get the subtitles out there. Okay, let's see. So on the Kapouse pool, I'm excited that we're getting that to a place where we can do something new. We've got to figure out and work with the neighborhood, understand what the needs are, work with McLean Associates to determine what the best use for that complex will be. So we'll keep working on that, and that's one piece of a whole revitalization plan for all of the parks in the city. So we will try to get a full plan going and fund it as soon as we can. We should be able to use rescue plan funding for that complex, so that's exciting. So we'll keep working on that, but it's part of a larger plan that we're working on in concert with McLean and Associates and City Council. I'll see if there's others. I know it was a very heavy beginning to this. I think it's really important though that we understand what's going on, and we still have our task force meetings about COVID every 2 weeks, and the last couple have been tough to deal with. But as you can imagine, the one post Thanksgiving has really been dark in a way that it felt last year. So I want to make sure people understand what's going on. We'll just see if there's any more questions. Oh, okay. So Brittany's asking about going into lockdown again. I don't think that a lockdown is where we'll end up going in Pennsylvania. We do have a vaccine. We have a COVID shot, right? So what's different now versus say from March to November of 2020 is that there is a shot for this. It's not the be all end all. It doesn't completely protect, but we didn't have that before. And that was why we had the lockdowns. Now there is a COVID shot. There is an ability for the vast majority of the population to go get protection. So I don't see lockdowns going on. It's, never say never in a pandemic that we're all living through in lifetime, but I really don't see that happening here. But in order to make sure that we don't ever get to that point, please encourage people to get the COVID shot. Okay, let's just see if there's anything else. All of the parks pieces are tied together, so we're trying to figure out what we want to do and how we fund it. I think we were very excited to get the grant for the NAOG pool a couple of weeks ago, or last week rather. $2 million is wonderful, but we're looking at maybe $6 million for the whole project. Then you have to add on top the engineering, which brings it to about $7 million. Where's that other $5 million coming from? We've got to figure out what that would look like. I know some city council members have suggested we borrow that money. That's a possibility, but we're also trying to avoid borrowing and adding to our debt loads. So we're in an interesting spot trying to do that. We have a great grants team trying to figure out what other what other subsidies we could find for NAOG. NAOG is not in an area where we can use rescue plan funds. So that's part of the difference between what we can do to fund CAPAUS versus NAOG. So CAPAUS, we've got more flexible funding options versus NAOG. So I think that's probably important. And I probably should have explained that previous to this if I haven't. Okay. So Debbie, I would reach out to our team. I'm wondering, that would be, I want to say Liza Carroll is lcarroll@scrantonpa.gov. It's L, her last name is 2 R's, 2 L's, Liza Carroll, 2 R's, 2 L's. So I would start with Liza. She's awesome. And John, the sewer sale easements are still going through. So there's a couple of escrow accounts actually. And it's unclear at this point if the city of Scranton or Dunmore will see proceeds from that. We certainly hope so, but we're not, if we do see money, I don't think we'll see it next year. The easement process is still going on. Thank you, Norma. And I wanted to say, Norma, I'm so sorry to need to talk to that person the other night in front of you. I had to run to something. I just wanted to make sure I made that point. So I didn't mean to get in your way of speaking with Jerry. Hopefully you were able to chat with him. And thank you for being there that night. Agree. I think we all can agree Norma is great, right? And up at NAOG all the time. Well, guys, thank you very much. We'll do another one next Friday. And I think we'll kind of base doing these during the holidays, whether we need to for COVID purposes. I'm happy to hop on anytime, but we'll do one next Friday and then maybe see if we can take Christmas Eve off. Please be safe. Encourage folks to get that COVID shot. 90% doesn't lie. 90% of those going to the hospital are not vaccinated. So thank you all. Be safe, stay warm, go see the pretty lights, and we'll see you right back here next Friday.